Hi, I'm Jane, and I study the difference in hepatocellular carcinoma subtypes between patients with cirrhosis and without cirrhosis. Hepatocellular carcinoma, also known as HCC, is derived from liver cells or hepatocytes and is the most common primary liver cancer and the second leading cause of cancer mortality in the world. Liver cirrhosis is a major risk factor for HCC, and about 80% of HCC arises in a cirrhotic liver worldwide. This is because the most common conditions that cause cirrhosis, such as alcohol, fatty liver disease, viral hepatitis C and B, lead to inflammation and cell injury, and this leads to increased hepatocellular regeneration. The increased cell proliferation during regeneration increases the chances of genetic mutations to accumulate in the cells, hence the transformation to malignancy. While the incidence of viral hepatitis C and B have been decreasing worldwide in recent years, the proportion of HCC in non-cirrhotic livers have been increasing. This growing number in non-cirrhotic patients with HCC is alarming and could possibly be related to the epidemic of obesity and non-alcoholic fatty liver disease. I will be mentored by Dr. Tamar Taddy and will be assisted by Dr. Ben Mazer. Dr. Taddy will facilitate my project and help with my understanding of HCC. She will also provide me with the clinical data for the liver cancer patients. Dr. Mazer will help with my understanding of different cancer subtypes and how to recognize them. I will be studying the slides under the microscopes to recognize and classify the different HCC subtypes. Only several publications have reported HCC arising in patients without cirrhosis. This study solely focused on HCC in the non-cirrhotic liver. It was found that those who had non-cirrhotic HCC had a larger tumor burden, yet had a higher survival rate. This shows that there are differences between the cirrhotic and non-cirrhotic liver, but this hasn't been explored yet. There are different histological phenotypes of HCC that include steatohepatitic type, sclerosis type, fibrolamellar type, and macrotubercular type, amongst many others. For this study, patients with HCC diagnosed at Yale New Haven Hospital and at the Veterans Hospital in West Haven will be retrospectively identified from institutional databases. The histological slides will be retrieved from the archives and reviewed under a light microscope in the Department of Pathology at Yale New Haven Hospital, and tumors will be subtyped using already published criteria. The correlation of HCC subtypes with the presence of cirrhosis will be analyzed statistically. The expected outcome is that steatohepatitic type will be more prevalent in livers with cirrhosis, while all the other types will be more common in non-cirrhotic livers. The implications of this study are that the data could potentially help hepatologists and physicians better identify HCC using phenotypes, and also determine how HCC develops in a non-cirrhotic liver. Thanks for watching!